as we go into perimenopause and menopause, we're more prone to certain things like cancer, heart disease, brain issues, and we call it the big three. And it's really important that as we go through perimenopause and into menopause, that we continue on this journey in looking at what we're eating, nutrition, what we're putting in our body, what we're putting on our body. How are we managing our stress? What are we doing on a regular basis? Are we taking deep breaths? Are we going for walks in nature? Are we exercising? What are you doing to help manage your breath? Are you are you meditating? Whatever it is that helps you manage your stress is really important. What supplements are you taking? Are you getting all your nutrients that you need from your food? Are you focusing on those nutrient dense foods? These are all things that we need to look at as we go into perimenopause and menopause because we're more susceptible to things. So, one of the things I've been talking about recently, and as I'm writing my book, I really wish that the definition or the term postmenopause would go away. Like, I wish there was just perimenopause and menopause. And the reason for that is because I'll speak to a lot of women and they'll say, oh, what are you doing? Oh, I'm working with women in perimenopause and menopause. They're like, oh, I'm so past that. And they might be 65 or they might have gone into menopause a little bit on the earlier side. And I'll say to them, I'm like, well, even though actually you're not really past it, even though you think you might be past it, you're not really past it because once you go into menopause, you're always in menopause. It's like puberty. Once you go through puberty, you're always in puberty for the rest of your life. And that is the case as we go into menopause. So, especially once we're in menopause and for the rest of our life, and that could be, by the way, a third of our lives, a half of our lives. I mean, we're all so different. It's really important that we focus on nutrition, on lifestyle, on supplements, on things, and not just taking any supplements, right? Being very focused and specific with the supplements you're taking for what your body needs. So, today's interview is great because I spoke to Dr. Joanne Manson, and I'll do an intro to who she is in a minute. But I wanted to talk about heart disease because recently my mom has been having issues with blood pressure. And a couple of weeks ago, we had to take her to the ER and I got schooled on blood pressure. I mean, I already knew, I knew blood pressure, high blood pressure is not great. And I've always had low blood pressure, but I wanted to take my blood pressure because of its effect on heart disease. So I asked my mom to bring over her home blood pressure cuff and I took my blood pressure and it was perfect. And then she had said to me, oh, I think I'm going to take mine too. So she took hers and it was really high, like scary high. And she's like, I think we need to go to the hospital. And this was like at 9:30 at night on a Saturday night. And I'm like, yeah, okay, yeah, sure, we should go. And I looked it up and I'm like, they're like, if you have it over a certain amount, you should go. And I was like, yeah, we should go. Anyways, we ended up staying there and they did a whole bunch of tests for her. And they told her they didn't really know what was causing it, but she was doing a couple of things that, I mean, especially her stress levels were very high. But on top of that, she was wearing a neck brace, the thing that goes around your neck, because she has a lot of issues. She had a concussion many years ago and she gets lightheaded a lot. So she was wearing that. And that was one of the things they said that could actually cause high blood pressure, as well as her diet wasn't pristine and certain things that she was doing. So we got schooled. Like I said, I got schooled in blood pressure, as did she. And she went to her doctor immediately after that and is doing everything she can to help lower her blood pressure. So today I wanted to talk to Dr. Manson about heart disease and what our risk is and what are some things that we can do to help manage our blood pressure, to help reduce our risk of heart disease as we go into this phase of life. So before I introduce you to Dr. Manson, I'm going to do a quick intro to who I am. If you're new to my podcast, Menopause Reimagined, welcome. I'm Andrea Donsky, and I'm a nutritionist. I've been one for almost 20 years. I've been in the natural health and wellness field for 25 years next year, which is a really long time. And I'm very passionate about helping you understand your health, understand when it comes to making choices as you enter into perimenopause and menopause. And my goal is to empower you to take control of your health and your symptoms in this phase of life. I'm a menopause educator and I'm a menopause researcher. So if you haven't filled out our surveys yet, please do. I put a link to them below. They'll literally take you under a minute. And I have some very exciting news coming up. I will announce that in the next little bit. to what's happening with our surveys and our research. So if you could please do me a favor right now, if you haven't filled out our signs and symptoms survey, we want to get to 5,000. We are really close. So if you could take a minute to fill that one out, as well as our other ones, I'd be super grateful. So now I'm going to bring in my guest. I'm speaking with Joanne Manson. She's been on our podcast before. She is on episode 77. So if you want to listen to that, I put a link to that below as well. She's an MD and a doctor of public health, and a professor of medicine and the Michael and Lee Bell Professor of Women's Health at Harvard Medical School, professor in the Department of Epidemiology, Harvard T.H. Chan School of Public Health, and chief of the Division of Preventative Medicine at Brigham and Women's Hospital. Dr. Manson is a physician, epidemiologist, endocrinologist, and principal investigator, or PI, or co-PI of several research studies, including the Women's Health Initiative Clinical Center in Boston, the cardiovascular component of the Nurses Health Study, the vitamin D and omega-3 trial, the Cosmos trial, and the vitamin D for COVID-19 trial. Her primary research interests include randomized clinical prevention trials of nutritional and lifestyle factors related to heart disease, diabetes, and cancer, the role of endogenous and exogenous estrogens as determinants of chronic disease, life course related risk factors for cardiovascular disease in women, and biomarker predictors of cardiovascular disease. Dr. Manson has received numerous honors, including the American Heart Association's AHA's Population Research Prize, AHA's Distinguished Scientists Award, and the Research Achievement Award. And Dr. Manson has published more than 1,200 peer-reviewed articles in the medical literature, is the author or editor of several books and textbooks, serves as editor-in-chief of contemporary clinical trials, and is past president of the North American Menopause Society. She's also one of the most highly cited researchers in the world, and was one of the physicians featured in the National Library of Medicine's exhibition, History of American Women Physicians. Now, here's Dr. Manson. Welcome back to Menopause Reimagined, Dr. Manson.
Good to see you, Andrea.
Today, so last time you were on, we talked about the Women's Health Initiative and hormones, and I'm going to put a link to that below. That was episode 77. So for those of you who didn't listen to our interview, I highly recommend going back and listening. And today we are going to talk about heart disease, because as we go into perimenopause and menopause, we are more prone to heart disease. So Dr. Manson is an expert on it, and I'm super excited to delve into it because it is such a big issue for us, isn't it?
Yes, absolutely. It's the leading cause of death in women. And the risk starts to increase even prior to menopause. And we do really try to emphasize preventive modalities.
So what would be when it comes to prevention? Obviously, my lane and your lane, you talk a lot about nutrition. I love that you're a medical doctor, but nutrition is a big focus for you. Nutrition, lifestyle. So what would you recommend that women look at when it comes to prevention for heart disease?
I think it's really important for women to think of the menopause as a window of opportunity for reducing risk, improving various lifestyle behaviors, because this is a transition stage when the risk of heart disease, stroke, overall cardiovascular disease, and also many forms of cancer and other chronic diseases increase. So thinking about it as a time period when you may want to intensify different behavioral and lifestyle factor, control, I think can be helpful in trying to reduce these very common chronic diseases that begin to increase. And we know that even prior to the final menstrual period, there are changes in metabolism. There are changes in body composition in particular. Not so much a weight gain or anything that women would notice on the scale, but there is a change of the fat distribution to be more in the abdomen and more centrally located. Now, this would probably be picked up among people who are monitoring their waist circumference, like if they're using a tape measure to regularly every few months or so just measure the waist, but may not be picked up on the scale. However, that's the distribution of fat that is most harmful in terms of cardiovascular risk, in terms of type 2 diabetes risk. So we see this redistribution of body fat. We also see an increase in the LDL cholesterol starting to occur right around the time periods are becoming irregular, and certainly by the time of the final menstrual period. And then there can be sleep changes, some disruptions in sleep related to hot flashes, night sweats.
Big one.
Um,
Yeah.
this is a big problem. Mood changes, some symptoms that difficulty concentrating due to sleep disruption and partially related to hot flashes and night sweats. So all of those changes can have an adverse effect on the cholesterol, risk of type 2 diabetes, and risk of cardiovascular disease.
Dr. Manson, you mentioned high LDL as being a risk factor. And I've interviewed several people like Dr. Johnny Bowden, who's written 15 books on cholesterol. And one of his books were called The Great Cholesterol Myth. And I've been reading a lot lately about how higher LDL actually is linked to longevity. Can you just shed some light on that? Because I feel like it's confusing for people, because we always heard, obviously you want to keep your LDL low, but it seems that things are changing a little bit, or maybe the mindset is changing. And also, what are things that we want to be looking at on a blood test? Is it more the HDL to triglyceride ratio? So I know that's two questions in one, but I'd love your thoughts.
I think it's very clear from randomized clinical trials, the experimental studies where you look at cholesterol lowering medications compared to placebo, that lowering cholesterol, lowering the LDL cholesterol is associated with a lower risk of heart disease, stroke, total cardiovascular disease, even all-cause mortality in many of the studies. But when you look observationally over, let's say, some of these studies where there's no intervention going on, you're just measuring the cholesterol level, the LDL cholesterol, HDL cholesterol, and then following forward for disease outcomes. Sometimes you do see that those who have a lower LDL cholesterol will do worse in terms of chronic disease outcomes and in terms of mortality than those who have a higher level. You can also see, paradoxically, that those who have higher body mass index in a obese category or overweight category seem to have lower risks of cardiovascular disease and mortality. Some of this is related to people losing weight when they have underlying chronic diseases and underlying health problems. So if they already have, let's say, a serious health condition, cancer, heart failure, chronic health, conditions, they may be losing weight. Some of this may be unintentional weight loss, and that can be associated with increased mortality, increased risk of adverse cardiovascular outcomes, and it can be very misleading. So we really base these associations on the randomized clinical trials. If you could show that lowering the LDL cholesterol and changing the lipid profile with an intervention, a medication, or a behavioral intervention, that suggests that there's a cause and effect relationship, because everything else balances out. Other health conditions, other lifestyle behaviors, other factors are will balance between the intervention group and the placebo group. That said, there are lipid variables that are more important than just LDL cholesterol. And in fact, it is important to look at particle size, particle number, HDL cholesterol, and ratio of LDL to HDL or total cholesterol to HDL. There are many ratios that are actually more
Right.
informative. So it's not just LDL. It does relate to other factors, determining whether lipids are favorable or unfavorable. But even just the simple measure of LDL cholesterol, the lowering of that in a randomized trial of like statin medications, other cholesterol lowering medications, or even behavioral factors that lower LDL, that tends to be associated with lower risk of heart disease, stroke, and total cardiovascular disease. So I think it's really a matter of whether we're talking about cause and effect relationships or associations that can be affected by other factors.
So how high of a number for the LDL is that when it becomes a concern? So for example, if it's a little bit high, is that a concern? If it's over a certain number, because as a society, we're so focused on numbers, right? You go to the doctor, you get a blood test done, and it's like, oh, you're out of this range. That means it's high. But we also know when it comes to certain things like thyroid health or TSH, that there's the normal range and then there's the optimal range. So what is the optimal range for LDL?
Well, certainly there is a gradient of increasing risk the higher you go. It actually even goes down to below 100, a level of LDL of 100 is lower risk than an LDL of 130 or 160 or 190. Once you get into the really high 100s, such as 190, then irrespective of other risk factors for heart disease, even if you don't have hypertension, diabetes, that it would be recommended that high LDL cholesterol be treated. At other levels, there's sort of a complex guideline to follow in terms of what other risk factors do you have for cardiovascular disease? What is your overall cardiovascular risk score? And it can be determined whether you would likely benefit from being started on statins. So it's a complex equation. I would say overall LDL is linked to risk of heart disease, and stroke. But if you generally have healthy, you don't have many risk factors for cardiovascular disease, you can tolerate being at a higher level, such as even 130, 150, levels like that, and you don't need to go on a cholesterol lowering medication. This is, talking about the LDL cholesterol specifically. It can be
Right.
more misleading with the total cholesterol level because some of that reflects the HDL cholesterol, considered the good cholesterol. So you
Right.
might be told by your healthcare provider that your total cholesterol is high at 220, 230, but it could be related to having a very high HDL cholesterol. So it is important to look at the LDL and the HDL and the triglycerides separately, and many of these lipid profiles will be done and will separate out those different components of the cholesterol. And the LDL cholesterol itself doesn't have to be only 70, 80, 90 or less than 100 if you're generally healthy and you don't have other risk factors for cardiovascular disease.
And so just for clarity, the LDL is better lower and the HDL is better at a higher number?
Higher LDL cholesterol is associated with increased risk, higher risk of cardiovascular disease. In contrast, a higher HDL cholesterol is associated with lower risk of cardiovascular disease.
Right. So better to have the higher HDL. So I have all these questions that are kind of going through my mind, and I want to make sure I ask them in a proper order. But okay, so my first question is for the ratios. So let's say you have a high LDL, but your other ratios are fine and your other markers are fine. Is that something? Because a lot of women might be listening right now, and because we're more prone to higher LDL, I just want everyone to be very clear when they're speaking to their doctor and to understand. So if everything else looks fine, but it's just their LDL is a little bit higher, what should they do?
Well, they don't necessarily have to go on statin medication or other therapy. I think it needs to be looked at in terms of what is the LDL, what's the HDL, what are the triglycerides, what are the other risk factors for cardiovascular disease? Is there hypertension? Is there diabetes? Is there elevated body mass index, especially a central adiposity or high waist circumference? All of these together can suggest what's called metabolic syndrome,
I was going to
which
ask you
is
about that
a
too. Yeah,
risk
great.
factor for cardiovascular disease. And the clinician will usually look very carefully at risk factor status, as well as the breakdown of the different types of cholesterol, and decide whether to initiate statin therapy or other cholesterol lowering therapy. It's also recommended to do what's called a cardiovascular risk score calculation. And
Okay.
that helps in deciding whether to start statin therapy or other cholesterol lowering medications. So taking all of these risk factors together, and we haven't even talked about cigarette smoking is also in that list. Your systolic blood pressure, whether you have diabetes, it includes, your age and many other factors. And from those variables, a cardiovascular risk factor score, let's say your 10-year risk of developing a cardiovascular event can be calculated. And that is very helpful to the patient and to the clinician in making decisions about initiating statin therapy or other cholesterol lowering medications. And by the way, it is really shared decision making, because it's not just a decision that should be dictated by the clinician, the physician, the healthcare provider.
Right.
It's for a discussion. This is what your 10-year risk is. You might have let's say, an 8% risk over the next 10 years of having a major cardiovascular event. Under certain circumstances, we might, start statin therapy if you're open to that. Usually once the risk gets to be clearly 10%, 10-year risk of cardiovascular disease, there will be a clearer recommendation for initiating cholesterol lowering medications. But often people will be in a middle range, in a gray zone, and there can be a lot of discussion about whether medication should be started, or whether more can be done with lifestyle modifications, in particular, increasing physical activity, improving diet. There's really no substitute for healthy diet and regular physical activity and these lifestyle behaviors for lowering cardiovascular risk. So usually we would start with, behavior modifications, lifestyle modifications. And then if the cholesterol remains elevated or the CVD risk score is still elevated, then statin therapy would be revisited.
Would the way to raise HDL be a similar way that you would lower LDL?
Well, physical activity, regular physical activity will do both. It will help, especially if someone's body mass index is elevated and they're in that higher range of weight, and they're losing weight with regular physical activity and healthy diet, they may see an increase in HDL related to the physical activity, as well as some reduction in LDL cholesterol. related to the physical activity and the weight change. There are also dietary factors that can influence the HDL and the LDL. You know, having a diet that is low in let's say the sugar sweetened beverages and refined carbohydrates, and tends to be whole grains, you know,
Right.
that is better. And also having higher intake of the mono or polyunsaturated fats as opposed to saturated fats. Certainly eliminate trans fats, but most of that type of fat has been eliminated from the products. But still choosing the unsaturated fats over saturated fats, leaning toward, for example, a Mediterranean type diet that's high in olive oil, you know, high in fish. The foods like that, and the whole grains and nuts, which can be quite helpful for reducing risk of cardiovascular disease. This is the type of diet that is linked to lower risk of cardiovascular disease, as well as diabetes and even cancer.
It's amazing how the Mediterranean diet has been like the most studied diet like out there. And yeah, it's amazing for so many different things. And what's interesting about saturated fat is I know that it's not the villain that it really was set out to be so many years ago with Ansel Keys, but I do believe moderation is so important, that we really want to make sure that we don't go overboard on anything, right? That it's having that moderation when it comes to what we're eating, and focusing, especially as we go into perimenopause and menopause, we need more protein, but what type of protein are you eating? So, you know, finding that moderation is important, I believe. But you know, interesting. I'd love to hear your take on that.
Well, moderation is tremendously important also because there will be low adherence to a diet if it's very demanding and it's very
Good point.
stringent in terms of reducing different, restricting different foods, or very markedly reducing fat intake or carb intake. I think it's really more a matter of quality of the diet than the quantity, even without changing total calorie intake and without having a really onerous type of diet to follow. You could have major improvements in health by leaning more toward whole foods, reducing
Hmm.
processed foods,
Yeah.
choosing, fish, poultry over red meat, really avoiding having a lot of red meat or processed foods. I think that can go a very long way. Reducing, if not totally eliminating, sugar sweetened beverages are a major source of empty calories,
Yeah.
linked to weight gain and type 2 diabetes. So there are many changes like that, but it can still be a very palatable and enjoyable diet. And many people who have made changes to the DASH diet or to the Mediterranean diet actually enjoy their meals more now than they did in the past. Some of these favorable changes, having more, we didn't talk about fruits and vegetables, are so important. Increasing fruits, vegetables, whole grains, restricting processed foods, really reducing the processed foods and red meat. Doesn't mean that any of these foods have to be totally eliminated, completely excluded from the diet, but just really reducing their intake
Yeah.
and making substitutions of those foods with the healthier foods, I think can lead to tremendous improvements in health.
What role does alcohol play when it comes to heart disease?
I mean, again, it's a matter of moderation. No one should think of alcohol as actually beneficial to health and something to start, increasing intake for the purpose of improving health. If you are already having moderate alcohol intake, which is often defined as like one alcoholic beverage a day in women, up to that amount, and up to 2 alcoholic beverages in men, because men and women metabolize alcohol differently. And,
Yeah.
basically women metabolize alcohol more slowly, so they cannot, tolerate as much alcohol. It begins to have adverse effects on the liver and the heart. But having alcohol intake at that level is not associated with substantial increases in risk of any health outcome. It has been linked, moderate intake of alcohol has been linked to some small increases in risk of breast cancer. There's some concern that there may be an increased risk of atrial fibrillation, which can be a particular issue among women. But overall, it is considered, consistent with a healthy lifestyle. And if it's something that, people are enjoying and they've been doing it for many, many years and they really enjoy it and they're doing well with it, there's no need to change, from moderate intake of alcohol to no intake. However, for a while, there was this perception that alcohol protected the heart. And many people who were not regular drinkers started to take up alcohol as a way to protect their hearts. We know that that is not advisable, and that, in fact, even, as I mentioned, even the moderate intake of alcohol may slightly increase risk of atrial fibrillation, may increase the risk of heart failure. We don't, these studies are somewhat limited, but I think overall, if it's part of a healthy dietary pattern, there's no need to eliminate it.
I want to talk about 2 more things before we end the interview. I want to talk about blood pressure, and I want to talk about metabolic syndrome. And then obviously, if there's anything else to add to helping to prevent it, prevent heart disease. So recently, my mom found out that she had high blood pressure, and she had never had high blood pressure. And so we ended up going to the emergency room a couple weeks ago, and I learned all about blood pressure, which I didn't really know much about beforehand. And because you were talking about other risks that are, so we have the blood test risks, and then other risks that could be a potential indicator of heart disease. And they did a whole bunch of tests, and it ended up they couldn't figure out why her blood pressure was high. Anyway, she ended up going on medication. But I'd love you to talk about blood pressure a little bit, because I know that's really important. And the reason it all started was because I wanted to know what my blood pressure was, because I never really took it. And she has a home blood pressure cuff. So we took it, and it actually was pretty accurate when we went to the hospital versus what her home blood pressure cuff told her, which was pretty. So for me, I was like, wow, that's something that we should have at home, because if it is accurate, well, obviously it is accurate. Obviously, you want to go get everything checked out by an actual doctor or the hospital or whatever you need to do. But it's one of those kind of like at-home tests that can give you an indication if there's something wrong. So can you talk about high blood pressure and how it relates to heart disease?
Well, blood pressure is a tremendously important factor to pay attention to, and it's just really underappreciated. And so, for example, it's the strongest risk factor we know of for stroke. It's a very strong risk factor for heart disease, and for overall cardiovascular disease, heart failure, many other forms of cardiovascular disease, and even all-cause mortality. It is one of the leading risk factors. And blood pressure does tend to increase with age in women. They're very, very strong a trajectory of increasing systolic blood pressure in particular as we age and as we reach, midlife, and then older age groups, a very, very high risk even of the isolated systolic, the first number, that top number, being very high, what we call isolated systolic hypertension. All these are risk factors. All these forms of hypertension are risk factors for heart disease, stroke, and other cardiovascular disease. So it is important to know your blood pressure. You know, we say know your numbers, and blood pressure, both your systolic and diastolic blood pressures, are related to your risk of cardiovascular disease. It is really important that you know your blood pressure and that you get it checked at least, you know, once a year, if not more often. I think people who already have an elevated blood pressure, it was very helpful to have home blood pressure monitor and be able to check it regularly. This can be particularly helpful if they've been started on medications, and this can lead to an earlier adjustment in a medication for blood pressure than otherwise if they're waiting for their next clinician visit, which may not be for many, many months. They can pick up the problem earlier. Also, there's something called white coat hypertension, where people may be very anxious, especially they just driven to their medical appointment. They were in a rush, you know, they're very stressed. They go into the office and their blood pressure is taken immediately. It may not be as representative as a blood pressure taken at home, you know, taken after they've been resting and sitting up and resting for a while. So I would strongly encourage home blood pressure monitoring, especially in people who have already been diagnosed. Diet is really important. Nutrition is really important for reducing the risk of hypertension. We know that sodium, salt intake, sodium chloride intake is a strong risk factor. Basically, we should be eliminating, you know, adding table salt to meals. But a lot of the salt is coming from processed foods. You know, you need to look at the labels. Fortunately, nutrition labels will tell you the sodium content, which can be very helpful. And, you know, there will tell you what the recommended amount is, and trying to keep that within the recommended intake is really important. Also, you know, fruits, vegetables, whole grains, what we've already been talking about, fish, you know, avoiding processed foods, avoiding a lot of red meat. These are different ways to keep blood pressure under control. Weight gain, adiposity gain, especially the central or abdominal fat gain, that is linked to an increase in blood pressure. So being physically active, having a heart healthy diet, avoiding the more typical weight gains that tend to occur with aging, avoiding excessive alcohol intake. And smoking also can affect blood pressure, but there's so many other reasons not to smoke. So these are all ways to try to control blood pressure and avoid one of the leading killers throughout the world.
Thank you. And the last thing I want to talk about is metabolic syndrome, because we are much more prone to it as we go into this phase of life. So if you can explain what it is, and then how it affects, or what effect it has on heart disease, I would appreciate that.
Well, metabolic syndrome, again, it's a constellation of risk factors that we've been talking about. One of its central causes is gain in the abdominal fat, which is very common with aging. There's this redistribution of fat, and that can often, and other causes, sedentary lifestyle, poor diet, can be associated with a clustering of risk factors. So including the high waist circumference, hypertension, so blood pressure is elevated, the blood sugar is elevated, often diabetes, you know, even diagnosed diabetes is present. The triglyceride levels can be high. That is very strongly linked to the higher waist circumference and abdominal adiposity, and the blood pressure increased, as I mentioned. So these risk factors tend to cluster. And the best way to avoid metabolic syndrome is with lifestyle modifications and having the heart healthy diet, having regular physical activity, getting enough sleep is so important. If, let's say, a woman is beginning to have irregular menstrual cycles and she's seems to be going through the perimenopause or menopause transition and starting to get hot flashes or night sweats that are disrupting sleep, or she's in early menopause and has disrupted sleep, this is something that she should discuss with her healthcare provider, because there are treatments available for that. And having disrupted sleep is associated with a lot of adverse health outcomes. So all of these are interrelated. I mean, it's really interesting how interrelated these factors are. And the underlying key is really healthy lifestyle. That comes first, the regular physical activity, not so much focusing on numbers on the scale, but focusing on being physically active, even walking 30 minutes a day, weight-bearing exercise. And being outdoors is great because that can be very calming in reducing stress, and just generally improving our connection to nature. So walking outside, being physically active outside, I think can be so important. And the healthy diet that we've talked about a number of times, basic principles of a healthy diet of, at least 5, if not even more, servings of fruits and vegetables, having salads and many servings of fruits and vegetables each day, favoring whole foods as opposed to the processed foods, especially reducing the ultra processed foods, and choosing fish, poultry as opposed to a lot of red meat, and the poly and monounsaturated fats as opposed to saturated fats. All of these dietary factors are really important to good health. Limiting alcohol, avoiding excessive alcohol intake, not smoking. These are so important. People hear this all the time. And because they hear, these recommendations all the time, they think, oh, I know that. I don't really need to even think about that. Well, the reason people are hearing this all the time is the evidence is so strong for these lifestyle behaviors and a healthy diet being important to maintaining good health and reducing risk of heart disease, stroke, type 2 diabetes, even many forms of cancer. There are at least 12 to 13 specific types of cancer that are related to weight gain, higher adiposity, and a lack of physical activity, and many of those factors as well. So it's just really important to think about prevention. Prevention is tremendously powerful. And, you often hear an ounce of prevention is worth a pound of cure. But I mean, it really is so important to think about trying to prevent these chronic diseases rather than at age 60, 70, 75, trying to treat with all these medications, a host of chronic diseases that have accrued over time.
And managing stress.
Managing stress is very important, in physical activity, and will also help with good, sleep patterns that will help with stress. These are all interrelated. I think we have an improved understanding of the importance of stress now, and it is tremendously important to optimal health, to manage stress and reduce stress. I think regular physical activity and having, not having disrupted sleep, having, high quality sleep is really, really important, as well as the social engagement. We haven't talked about that yet, but really tremendously important to spend time with family, friends, other people, having conversations, being outdoors together, doing sports and physical activity together. The social engagement is so important. Also really, really important for cognitive health, for avoiding, memory loss, cognitive decline, social interactions, physical activity. These are all of these outcomes are strongly interrelated.
I love that. Thank you so much, Dr. Manson. That was a great way to summarize everything that we were talking about today. And I appreciate you doing this interview.
Okay, good to see you, Andrea. Have a good day. Bye now.
You too. I hope you enjoyed my interview with Dr. Manson. And she talked about all the things that we talk about on a regular basis here at Menopause Reimagined: the whole foods diet, really being mindful of what you're putting in your body, movement, managing stress, exercise. All of that is really important. And sleep, the benefit of sleep. If you are having trouble with sleep, I would love you to try our magnesium and our Sleep Us product. Literally, the cortisol calm bundle will change your life. If you are having trouble with sleep and you are waking up in the middle of the night, it will help. You just have to give it time. It takes about 2 or 3 months to really kick in. But if you're waking up to go to the bathroom during the night, or you're just waking up between 2 and 4 a.m. and you can't go back to sleep, or you can't get more than 2 hours of sleep in a row, please give it a try. It is such a good product, such a good combination. You could try the magnesium to start, or you could try the Sleep Us, or the combination of both, which is incredible. So I'll put a link below to our cortisol calm bundle, as well as Sleep Us and magnesium. And our magnesium is magnesium bisglycinate, which just helps us to relax. It helps to relax your muscles, and it will help you get that better night's sleep. And the nice thing about Sleep Us and magnesium together is it'll help you get more deep sleep. So even if you're getting, let's say, 6 or 7 hours of sleep, you're going to wake up refreshed because you're getting a better quality sleep and deeper sleep. So if you enjoyed today's interview, please share it, because the more you share shows you care. And please leave a review for Menopause Reimagined. I saw some of you who have left a review recently, and I'm so grateful to you, because when you leave a review, it actually tells the algorithm to send our podcast out to more people so that we can help more women who are going through perimenopause and menopause. Thank you for spending the last little bit with me. I appreciate you. I know there's a lot of other things you could be doing, but you chose to spend it with me. So thank you. I'll see you at the next interview.